Hello again, everybody. This is Marty Guthmiller. I am CEO at Orange City Area Health System, bringing you today the 38th edition of the COVID-19 community briefings. We're a little bit out of our routine this week. I usually try to do Mondays and Thursdays, but yesterday, for some reason, I wasn't able to get the data off the corona.iowa.gov website. This morning I was able to do so, and so we're going to relay that information to you today. As has been our practice over the last few weeks, I don't have an update for you on the local scoreboard because I get those updates once a week now, every Monday morning. And so on Monday, I'll plan on coming back again and giving you that update. From my indication, knowledge I have, nothing has substantially changed here, so we don't anticipate a big thing to report on Monday. But again, I'll do that then. Again, a reminder: when we reported last Monday, our positive rate here, testing rate in Orange City is 5.8%. So a pretty good number there. So we'll jump right in then and go through the hierarchy of stats and then drill down on a few of those as well. So first of all, Sioux County. We've had 523 positives in Sioux County of 3,364 tested. That's 1 out of every 10 Sioux Countyans at this point have been tested, and that positive rate is 15.5%. As we talk about things today a little bit, you'll notice that rate remains high, 15.5, but it is coming down slightly. The last time we talked, it was 15.6, and the time before that, 15.9. So at least we're heading in the right direction. But that number, again, as maybe you can remember, was over 20. At one point when we had a kind of an industrial breakout here a little bit. But more on that to come. Next, we'll move to Region 3. Average to good news there, maybe 31 hospitalized. When we spoke on the 13th, that number was 34. So a 3 admit drop there. We've had 2 admissions in the last 24 hours in this Northwest Iowa County Coalition, and we've had 11 now in the ICU, and that number when we spoke the other day was 12. So static to maybe a little bit of improvement in Region 3. One of the things we want to make sure, of course, and one of the reasons for flattening the curve was to make sure beds were available and systems were not overwhelmed. There's currently 51% bed availability in Region 3. And what does that mean? How many beds in Region 3? There are 506 beds in this 20-county region, 506. And so 51% availability would be something north of 250 beds available. So we have availability. In today's world of treating COVID is not so much the availability of ventilators as it was earlier. It's the availability of beds. Vents have been, the use of vents have been diminished a little bit as we've learned more about the attributes of treating the virus. So plenty of bed availability locally and regionally. Going to the state level then, 37,528 positives in the state of Iowa, of 400,869 tested. And so 1 out of every 8 Iowans have now been tested. The positive rate has remained the same for the last 4 times that we've talked now at 9.4%. It can't get any more consistent than that. Yesterday, the rate in the state of Iowa was 7.4%. So not a big enough drop to change anything from the statewide numbers, but yet maybe an indication that things are going in the right direction. An indication that things are not going in the right direction, though, is hospitalizations. we've seen an uptick in hospitalizations in Iowa. Basically, this will be the fourth time now that we've talked about an increase in the number of hospitalizations. Currently in Iowa, we have 182 hospitalized COVID-19 patients. That number previously was 169. The time before that was 157, and the time before that 129. So we've had an uptick in hospitalizations, and when you hear about things that, like I'm going to talk about in a little bit, where stuff is Iowa is still having issues, it's probably along these lines a little bit. We want to talk about locally though. Sioux County has 2 patients hospitalized at this point. Lyon and O'Brien remain at 0. Plymouth County is down to 1. They were at 4, 3 or 4 the last time we talked. Clay is 0. Dickinson 1. BV County is down to 3 now. But actually they were 2 last time, so 1 more admission. Woodbury County has really been fairly stable lately. They are at 13. That's Sioux City, of course. And the last time we talked, they were at 15. Polk County, very consistent again. They're at 32. The last we had talked, they were at 31. Recently, they've been at 29. So they're right in that range. With that said, I counted 7 counties now in the state of Iowa that have 10 or more COVID-19 patients. That is a significant uptick. Before, it was always Polk County number 1, Woodbury County number 2, then at one point BV was number 3. But number 3 was really in that 7 range for the most part after BV. And so now with 10 or 7, with 10 or more, that is kind of a broad-based uptick that is not necessarily a good number. The deaths are not a good number as well. We've had 30 additional deaths since the last time we talked on the 13th. That trend is trending slightly up at 30. So another indication that vigilance is still required, that this thing is not over, and that we may not have hit mile 20 in that 26-mile marathon just quite yet. I'm going to jump to people forward me some information on occasion, or they ask me questions about this and that. This is one that you may have read about, you may have heard about, and it deals with a White House task force report that was not issued. So right there, you kind of wonder, okay, well, what's going on? Is the report legit? Why wasn't it issued? But there was a link provided to me from the Sioux City Journal that dealt with this. And this listed 5 counties in Iowa that were in the red zone. You don't want to be in the red zone. Red zone is not a good place to be. There were 5 counties listed in the red zone, and Sioux County was one of them. Sioux, Osceola, Webster, Franklin, and Clark counties were listed. Really a surprise to me, quite frankly. And you have to dig into how do they define a red zone and things like that. And one of the cases is that there's a greater than 100 per 100,000 rise in the infection rate or your positive rate, or a 10% positive increase in your testing. Kind of hard to evaluate that a little bit, but I did go back and look and give you an idea, because I sure wouldn't list off of my metrics Sioux County as a red zone, but here is some information regarding that. The number of cases per 100,000 population. So if you extrapolate Sioux County with whatever we are, 34, 35,000 population, if you extrapolate that over 100,000 population, our rate would be 1,498. So just short of 1,500 positives per 100,000 population. That by itself doesn't mean anything. So you have to look at what that is relative to other counties. So as an example, and keep in mind at 1,498 rate per 100,000, Sioux County has had 0 deaths. Plymouth County has had 1,466 per 100,000 population, so slightly lower. They have had 5 deaths in Plymouth County. Dickinson County is 1,860 positives per 100,000, so another 300 or so more per 100,000 than us. On the other hand, Clay County is half of that amount at 961. Polk County, which we've always measured as, and the number of hospitalizations there, we've always looked at that, 1,648. So 1,648 compared to our 1,498. Woodbury County, 3,330. So over double what our rate in Sioux County is. And then BV County, 8,780 positives per 100,000, or 5 times, almost 5 times what our rate in Sioux County is. So I'm not really sure what's going on with the red zone designation for Sioux County. I certainly don't want anybody to panic over that. I don't believe any governmental intervention is required because of that. We aren't seeing that in our health system. The number of hospitalizations in Sioux County does not represent a red zone. The number of deaths in Sioux County at 0 does not represent a red zone. And so be real careful when you look at information, look at how it's defined, the time frame that it's given in. Again, I'm not downplaying it. I'm sure there's some legitimacy somewhere to those numbers, and technically they may be right in some areas and how it's defined. But at the ground level here, I can tell you that we aren't in the red zone from our perspective. However, with that said, again, this thing is not over, and continued discipline is required of all of us, but applied in a common sense approach. I've said this, let's see, this is a 38 edition, so I probably said it 37 times previously. Use proper hand hygiene, wash your hands, use disinfectant, socially distance yourself when it's possible. Whenever you can do the 6 feet, less than 15-minute thing, do that. When you can't, make sure you're masked. I still see people wearing masks in cars. They're all by themselves. If that makes you feel comfortable, okay. I don't think you're really helping society or yourself by doing that, but if you feel okay with that, that's all right. But again, make sure that the 6:15 rule is being followed. Get outside, enjoy yourself, live your life. And again, I've been mentioning too, because this is all over the place, is you got to try to live a grace-filled life. We aren't all going to get this right. All I'm trying to do is give you some information here. You read in the paper that Sioux County is a red zone, you go, oh my gosh, I can't go to the baseball game tonight. Go to the baseball game tonight, all right? Go ahead. You don't need to congregate and sit on somebody's lap, but on the other hand, go to the baseball game and enjoy yourself. Have a great weekend. We plan on being back on Monday. I'll update the local scoreboard. And again, I remind you to stay vigilant, stay strong, and above all else, stay healthy. Thank you again for joining us.